Hi, my name's Greg. I'm here on the Hamilton Rail Trail, a very popular place for people to come and exercise by running, walking, cycling, walking their dog, what have you. Now, unfortunately, every once in a while when someone is exercising, they'll injure themselves, whether it be a sprained ankle, a twisted knee, or perhaps even a lower back injury. Now, as a registered massage therapist, some of the most frequently asked questions are, do I put heat or ice on it, and if so, for how long? Well, as a general rule of thumb, you always want to ice an injury within the first 24 to 48 hours, okay? Sometimes there are exceptions to the rule, and you may want to ice the injury for longer periods than that, say for a week or 2 weeks, depending on the severity of the injury and the amount of swelling in the injured area. When you injure yourself, perhaps you sprain your ankle, what happens is you get a huge increase of blood flow to the area. That will cause swelling, and along with that swelling you'll get some pain, more pain in the area possibly, and then in the healing process, more scar tissue. Now what ice does is it constricts the blood vessels, allowing less blood flow to the area and therefore less swelling and less pain, and then less scar tissue in the end. Now, the difference between heat and ice is this. What heat will do is will allow more blood flow to an area, which can cause an area to swell up and hurt a lot more, and therefore you would get more scar tissue in the end. So what actually happens when you put heat or ice on an injury that gets rid of the pain? Well, when you put ice on an injury, what will happen is that ice will slow the pain signal along the neural pathway to the brain down, and therefore you'll feel less pain less often, hopefully until the pain disappears altogether. When you put heat on an injury, what will happen is that heat signal will travel along the neural pathway to the brain faster than the pain signal. So you have the heat going like this and the pain going like this, and so the heat signal cancels out the pain signal, so you don't feel as much pain. That's why all these heat rubs actually work. There's a chemical reaction taking place in your skin so that you feel the sensation of heat, and it will travel along the neural pathway to the brain faster than the sensation of pain. As an aside, what you should never do is put that heat rub on the injury and then go and use that joint rigorously. Otherwise, you could make the injury worse. Well, when you're icing an injury, you're going to go through 3 stages. There's that burning stage when you first apply the ice, okay, and what happens is the blood vessels constrict, and as they do, they push that blood away from the injured area. That's why you feel the burning. The next stage is the achy stage, and then after that you'll go through a numbing or freezing stage. As soon as you start to feel that numbing stage, you can take the ice off, because then you're just freezing the tissue. Always too, remember to put a barrier between the ice and your skin so you don't get skin burn. So I hope that's helped you. Have a great day and safe exercising.